Well, if you're traveling internationally in the near future, are you prepared to stay healthy on your trip? It's not usually part of your planning process, but doctors at Spectrum Health say it should be. We're learning more about the Helen DeVos Children's Hospital Travel Medicine Clinic in this week's Medical Moment. Getting sick while traveling is the last thing you want to have happen on your trip, especially if you or your child has a compromised immune system. That's where the Helen DeVos Children's Hospital Travel Medicine Clinic can help.
For the most part, people who come to see us in Travel Medicine Clinic are actually healthy. So we're not actually treating a specific condition that they have. We're more preparing them to stay healthy when they're traveling.
Dr. Rosemary Olivero, the director of the Travel Medicine Clinic, says they can provide recommended vaccines for certain areas or even medications to keep you safe. But the biggest thing they do is making sure you're prepared.
To me, the first and the most important thing is education, helping people understand where they're traveling and what that might look like and what some potential health risks they could encounter when they're traveling.
While the clinic in Helen DeVos caters to children, Dr. Olivero says they'll see the whole family.
If a child needs a vaccine for travel and mom and dad are also getting a vaccine, that can make it seem a little bit less scary.
Dr. Olivero says you don't need vaccines for most countries, but there are exceptions.
Outside of those kind of very high-end resorts and Western Europe, we almost always would recommend a travel medicine consultation.
The majority of that consultation involves going over your itinerary to identify health risks and learning how to stay safe.
So if you're traveling to Southeast Asia and you're going to multiple different countries, your risk may vary depending on what country or even what region or city that you're in.
If you need vaccines for your trip, just plan ahead.
For the most part, if we see you 4 to 6 weeks before you travel, that is more than enough time to get everything done that we need done.
And if you're unsure whether or not you'll need a vaccine, you can always ask your primary care provider and go from there.
So I just encourage people to think about that while they're budgeting and thinking about their trip, just so that you don't shortchange your health just to take that trip.